Hello, Dr. Joe here. Now, if you're a man or woman living on this planet, then there's a very good chance that you are using one of these medications that I've got on this very list, or you have used that medication in the past. So, which one is it? There's only one way to find out, and that is you watch the video. And more importantly, how does that medication interact with your kidneys? That is what we need to find out. Let's get started.
Let's talk about medications that hurt your kidneys. Let's move on to the very first class of medications that hurt the kidneys. And here you have medications like ibuprofen, which is an over-the-counter medication, naproxen. You've got the brand names of Aleve and Aprox, Feminax, Accord, Advil, Nurofen, Motrin, and Ibuleve. So these medications, they belong to a class of medications called non-steroidal anti-inflammatory drugs, NSAIDs. They're called. How do they cause kidney problems? Well, first of all, they are popular painkillers. However, they are toxic to your kidneys, especially when taken regularly every day, or if you are elderly. And research tells us that 15% of the cases of drug-induced acute renal failure are caused by these non-steroidal anti-inflammatory medications. So yes, they are very much around and they can cause serious problems for the kidneys. So much so that this very research here that was published in the American Journal of Kidney Disease with a title non-steroidal anti-inflammatory drugs and risk of acute renal failure in the general population reached this very conclusion. And it said that NSAID users had a threefold greater risk for developing a first ever diagnosis of clinical acute renal failure compared with non-users of NSAID. There we go. These medications are a problem. They have their uses, but they can harm your kidneys, okay? These popular medications, the ibuprofen, the naproxen, the Voltarol, they can hurt your kidneys.
So that's group number one. Let's talk about group number two of medications that could harm your kidneys.
These are the laxatives, okay? Some laxatives, in particular sodium phosphate laxatives. So here we've got a sodium phosphate solution here, and we also have this brand name here, Foslax. Now, they're useful for bowel preparation before colonoscopy. Colonoscopy is when we put in a camera inside the large bowel, and they're also prescribed for some patients who have problems doing their number two regularly, but they are toxic to the kidneys because they can cause sudden loss of kidney function or acute kidney injury, okay, AKI. And they can also cause blood mineral disturbances. So, yeah, they're useful, but they do cause problems. So how do they do this? Well, the way these laxatives cause problems for the kidneys is that they dump phosphate crystals in the kidney tissues. And that gradually leads to loss of kidney function. That will lead to kidney failure in the end. So the phenomenon is called acute phosphate nephropathy. So yes, they're useful for clearing the bowel, but they do have adverse effects on the kidneys.
Now, group number three of medications that could harm your kidneys.
And these are the proton pump inhibitors, okay? Proton pump inhibitors, we call them PPIs. And you have all these generic names like omeprazole, esomeprazole, lansoprazole, and pantoprazole. And you have these brand names here, Prilosec and Nexium. So these proton pump inhibitors, they are useful for stomach ulcers, heartburn, and acid reflux, GERD. You also have these brand names, Protonix and Prevacid 24-hour. They're useful for that function, dealing with acids in the stomach. However, they can harm your kidneys because they can cause inflammation of kidney tissue, leading to gradual loss of kidney function. And the phenomenon is called acute interstitial nephritis. So what I have said here is that these drugs, they are harmful to your kidneys, and better alternatives would be medications like famotidine and nizatidine. Okay, so you can either use famotidine or nizatidine as alternatives to your Prilosec and Nexium.
How about we jump on to group number 4 of medications that could hurt your kidneys?
And those are the blood thinners. Coumadin is a classic example. Warfarin is the generic name. And how does warfarin cause harm to the kidneys? Well, excess warfarin in the body, which is very easy to do, by the way, can cause bleeding into kidney tissues. And over time, that will lead to formation of what we call red blood cell casts. And those red blood cell casts will block the kidney tubules. And obviously, that will cause obstruction to the free flow of urine through the kidneys. And that is how warfarin can cause harm to the kidneys.
And now it's time for group number 5.
And now medication class number 5. And of course, statins cannot be left out because they are also involved in harm to the kidneys too. So you got brand names here like Zocor, Lipitor, Lescol XL, and Altoprev. So that's atorvastatin, rosuvastatin. How do they cause the problem? Well, we're not exactly sure how the statins cause kidney problems, but we do have case reports of statins doing this. For instance, this one here that was published in the Indian Journal of Nephrology with the title Acute Interstitial Nephritis Due to Statin and Its Class Effect. This is a case report of a 54-year-old man who developed inflammation of the kidneys, what we call acute interstitial nephritis, which was confirmed on biopsy of the kidneys. He was using atorvastatin at the time. The doctors stopped the atorvastatin and gave him some steroids, and the kidneys recovered. So what they then did was they thought, okay, let's try another statin to see whether he's going to tolerate it. So they gave him rosuvastatin 6 months later, and what do you know? Well, the same problem recurred again. So, I mean, the point was made that the statins were responsible for the man having inflammation of the kidneys. So statins are not to be messed with. They cause liver problems, they cause muscle problems, and they also cause kidney problems.
So, how about we explore group number 6 of medications that could harm your kidneys?
These are some antibiotics, and they fall into the class of antibiotics we call the aminoglycosides. So examples will be gentamicin, streptomycin, tobramycin, and neomycin. How do they cause this problem? How do these antibiotics cause harm to the kidneys? Well, the way they do that is they accumulate, the medications that is, accumulate in the kidney cells, and they cause gradual subclinical damage to the cells of the kidneys. And over time, that will manifest as a reduction in your GFR. This is glomerular filtration rate. So your GFR will keep going down and down as you continue to use these very medications. The other thing is that these medications, in particular gentamicin, they also harm the ears as well.
And finally, group number 7 of medications that could harm your kidneys.
And that would be the anti-epileptic medications, some of them. And in particular, these brand names can be harmful to the kidneys: Epilim, Keppra, Topamax, Zonegran. So the generic names are sodium valproate and topiramate. And how do they cause harm to the kidneys? Well, they make it difficult for your kidneys to reabsorb certain substances. So you end up losing electrolytes and vital nutrients in the urine. This concept is called the Fanconi syndrome. Okay, Fanconi syndrome. And it can lead to all sorts of problems like excessive thirst, excessive urination, fatigue, muscle pain, dehydration, all sorts of symptoms. So, something not to be messed with. The other thing is that these anti-epileptic medications can also predispose to kidney stone formation too. So, these medications are really harmful to the kidneys and something for you to look out for.
That's it. 7 group of medications that potentially could harm your kidneys. You've only got a pair of kidneys. Please look after them. So hopefully you got some value from this very video. If you did, please give the video a thumbs up. Please like the video, and also please share this video with your friends, with your family, with your colleagues. You got any questions, any comments regarding the content of this video presentation, go ahead, leave your comments or questions down below. I think that's it for this very video. Until next time, well, this is Dr. Joe signing out.